Hi, welcome back again to Vital Sphere. Today, we will talk about fatality symptoms, the journey from legs to death. The human body often provides warning signs before a critical or fatal event. Many severe health conditions such as blood clots, infections, neurological disorders, and organ failure exhibit symptoms that begin in the legs and gradually progress throughout the body, eventually leading to death if left untreated. Recognizing these early warning signs can be life-saving. Leg pain and weakness. Circulatory and neurological issues. Some of the earliest signs of a potentially fatal condition can be unexplained leg pain or weakness. This may indicate deep vein thrombosis (DVT), a serious blood clot that can travel to the lungs and cause a fatal pulmonary embolism. Similarly, progressive weakness in the legs may signal neuromuscular disorders such as Guillain-Barré syndrome, which can lead to full body paralysis and respiratory failure. Real-life case: silent killer James, a 45-year-old businessman, ignored his persistent calf pain for weeks. He assumed it was just a muscle strain. One day, while at work, he suddenly collapsed. Paramedics later confirmed a pulmonary embolism caused by an undiagnosed DVT. He survived, but doctors warned that if he had waited longer, the clot could have been fatal. Professional advice: Dr. Rebecca Collins, a vascular specialist, advises, if you experience persistent leg pain, especially with swelling and redness, do not dismiss it as minor discomfort. Seek medical evaluation immediately.
Swelling and skin discoloration. Clots and infections, swelling, redness or bluish skin, cyanosis in the legs, may be a sign of poor circulation or an advanced infection such as necrotizing fasciitis, flesh-eating disease. When infections become systemic, sepsis, they can lead to organ failure and death if not treated promptly. Real-life case. A mother's fight against sepsis. Maria, a 38-year-old mother, developed a small wound on her foot that became infected. She ignored it until her leg became swollen and turned dark purple. By the time she sought help, she was in septic shock. Despite aggressive treatment, doctors had to amputate her leg to save her life. Professional advice. Dr. Alan Thompson, an infectious disease specialist, says, even a minor wound can become deadly if not monitored. If you notice increasing pain, spreading redness, or fever, seek immediate medical attention. Difficulty walking and shortness of breath, stroke and heart failure, trouble walking, frequent falls, or sudden paralysis may be signs of stroke, multiple sclerosis, or advanced diabetes complications. If a stroke occurs, a patient may experience slurred speech, facial drooping, and confusion before losing consciousness, leading to death without immediate medical intervention. Real-life case. A grandfather's final warning. Richard, a 67-year-old retired teacher, noticed he was struggling to lift his left foot while walking. His family dismissed it as old age. A week later, he collapsed at home and was rushed to the hospital, where he was diagnosed with an ischemic stroke. Despite medical intervention, he passed away within 2 days due to complications. Professional advice. Dr. Susan Patel, a neurologist, states, stroke symptoms should never be ignored. Sudden difficulty walking, weakness in the legs, or unexplained dizziness requires immediate emergency care. Time is critical. Systemic failure, sepsis, shock, and organ shutdown. Once the infection, clot, or cardiovascular failure progresses, septic shock or multi-organ failure may set in. The body's organs shut down one by one, leading to unconsciousness, coma, and eventually death. Low blood pressure, confusion, extreme fatigue, and a weak pulse are common signs in the final stage. Final signs: loss of consciousness and organ failure. In the last moments before death, the body enters a state of agonal breathing, gasping, unconsciousness, and a weak or absent pulse. The heart slows down, oxygen supply diminishes, and the body finally succumbs. Conclusion. Leg-related symptoms, while often overlooked, can serve as critical early indicators of life-threatening conditions. Understanding these warning signs and seeking medical help immediately can make the difference between life and death. Key takeaways: persistent leg pain and swelling should not be ignored. Skin discoloration or a slow-healing wound could be life-threatening. Difficulty walking may be an early sign of a stroke or cardiovascular disease. Any sign of infection spreading to the legs requires urgent medical intervention. Early treatment is critical in preventing fatal complications. Recognizing these symptoms and acting fast could save a life, perhaps even your own. Leg health and its impact on the rest of the body. The health of our legs plays a crucial role in our overall well-being. While many people view leg pain, swelling, or weakness as minor discomforts, these symptoms can be indicators of serious health conditions affecting other parts of the body. Poor leg health can contribute to circulatory issues, neurological disorders, and systemic diseases, ultimately leading to life-threatening complications. Poor circulation and cardiovascular disease blood flow issues in the legs often signal broader cardiovascular problems. Peripheral artery disease, PAD, occurs when arteries in the legs become narrowed due to plaque buildup, reducing blood circulation. This can lead to pain, ulcers, and even amputation. Worse, PAD increases the risk of heart attacks and strokes. Real-life case. A warning. Ignored Mark, a 58-year-old construction worker, frequently felt numbness and cramping in his legs while walking. Assuming it was just fatigue, he ignored it. A year later, he suffered a massive heart attack. Doctors linked his cardiovascular disease to undiagnosed PAD, which had restricted blood flow not only in his legs, but also in his heart. Professional advice. Dr. Lisa Henderson, a cardiologist, warns, if you experience persistent leg pain, numbness, or slow-healing wounds, get a cardiovascular evaluation. Your leg health can be a window into your heart health. Leg infections and sepsis. Even minor infections in the legs can escalate into sepsis, a life-threatening condition where the body's response to infection damages its own tissues. People with diabetes, poor circulation, or weak immune systems are particularly vulnerable. Real-life case. A simple scratch turned. Deadly Samantha, a 42-year-old teacher, scraped her leg while hiking. She ignored the wound until it became red and swollen. Within days, she developed a fever and confusion. She was diagnosed with sepsis and spent weeks in the ICU. Doctors had to remove the infected tissue to save her life. Professional advice. Dr. Alan Wright, an infectious disease expert, states, any wound on the leg that shows signs of spreading redness, swelling, or warmth should be treated immediately. Early antibiotic treatment can prevent life-threatening infections. Blood clots. A silent killer. Blood clots in the legs, known as deep vein thrombosis, DVT, can break loose and travel to the lungs, causing a pulmonary embolism. This can be fatal if not treated quickly. Real-life case. A long flight's deadly consequence. David, a 35-year-old businessman, took a long-haul flight and felt mild pain in his calf upon landing. Days later, he collapsed while jogging. Doctors found a blood clot had traveled from his leg to his lungs, causing a fatal embolism. Professional advice. Dr. Rebecca Simmons, a vascular specialist, advises, avoid prolonged sitting, stay hydrated, and move your legs regularly. If you experience unexplained leg pain and swelling, seek medical attention immediately. Nerve damage and mobility loss conditions like diabetic neuropathy or multiple sclerosis often start with numbness, tingling, or weakness in the legs. Over time, this can affect balance, mobility, and even bladder and bowel function. Real-life case. A missed diagnosis, Paul, a 50-year-old accountant, started experiencing tingling in his feet but dismissed it. Over time, he developed severe balance issues. After a series of tests, he was diagnosed with multiple sclerosis, a neurological disorder affecting the entire body. Professional advice. Dr. Susan Patel, a neurologist, says, Early signs of nerve damage in the legs should never be ignored. Proper diagnosis and treatment can slow disease progression and improve quality of life. Bone and joint issues. Affecting overall health. Chronic leg pain from conditions like arthritis, osteoporosis, or sciatica can affect posture, leading to back problems, spinal misalignment, and an increased risk of falls and fractures. Real-life case. The chain reaction. Martha, a 65-year-old retiree, suffered from untreated knee arthritis. To compensate for the pain, she altered her walking posture, leading to chronic back pain and a hip fracture after a minor fall. Professional advice. Dr. Robert Carter, an orthopedic specialist, advises joint pain and stiffness should be addressed early with physical therapy and lifestyle changes to prevent further complications. Conclusion. Leg health is deeply interconnected with the rest of the body. Whether it's circulatory issues, infections, blood clots, nerve damage, or bone disorders, symptoms in the legs can be early warnings of systemic health problems. By recognizing these signs and seeking timely medical care, individuals can prevent serious complications and improve overall well-being. Key takeaways. Leg pain and poor circulation can signal heart disease. Untreated infections in the legs may lead to sepsis. Blood clots in the legs can be fatal if they travel to the lungs. Nerve damage in the legs can indicate neurological disorders. Joint problems can impact posture and increase fall risks. Prioritizing leg health is essential for maintaining a strong and healthy body. If you notice any concerning symptoms, consult a medical professional as soon as possible. Thank you for watching at Vital Sphere. Do check back again.